Welcome back to NTV News First Edition. It is time for this week's Get Psyched with Dr. Janine Hubbard. Now, last week we talked about Psychology Month and what a psychologist is. Well, this week we're going to discuss therapy. What is it and who can or should access it? Welcome, Dr. Janine. It's great to see you.
Well, likewise. Yes, I couldn't believe when I finished the segment last week and I went, I forgot to talk about counseling and therapy as something psychologists do, given that it is the bulk of what many of my colleagues do. So maybe we should talk more about that.
Yeah, so let's start simply. What is therapy?
Therapy can look very different and comes in many shapes and forms. It could be a single session. It could be something that's highly structured, sort of a planned program over several weeks. It could be something that lasts for months or years or even involves, like a yearly check-in. And we know that it could be individual, it could be family, it could be couple, it could be group. Again, it can look very different, but ultimately it's for people who are experiencing some form of emotional distress or want to make some changes in their lives, or perhaps want to learn a little bit more about, maybe there's some patterns in my life or my relationships that I'd like some help with. So it can cover the full gamut.
Now, is there a difference between therapy and counseling?
Well, there's certainly a lot of overlap, but I'm so glad you asked because that is such a commonly confused, and the terms are used interchangeably. And these are some gross generalizations, so bear with me. Therapy is often far more goal-oriented. It's often a much more structured or evidence-based program, and it's very often targeted at a specific diagnosis, for example. And again, it can be individual or it can be group, but it is often involves a lot of hard work, both in session and as part of homework, to work towards some of those long-term changes. In contrast, supportive counseling is often having somebody and a safe space and someone who isn't intimately involved in your life be able to hear what's going on, listen to your concerns, perhaps make some suggestions, but in many, many ways provide you with a safe outlet to explore your thoughts and feelings and moving forward. One of the best analogies that I've come up with over the years is because there's a time and a space for both of them. If I happen to be lucky enough to go to the spa and have a facial, I get a neck massage, maybe I get a hand and arm massage, I leave feeling fabulous. I've got a boost, there's a lift in my step, I'm feeling great, but it's temporary. When I go to see my registered massage therapist, who I've been seeing for probably 15 years now, I'll be honest, she both works proactively on things to keep things under control and then addresses new acute issues that come up. And I expect to be in pain for about 3 days after I go to a session with her. Both have very valid times and places in our lives. They just meet different needs, that's all.
Okay, so we are nearly out of time, but before we go, probably one of the most important questions, where do I go to get therapy, and do I need a referral?
Typically, you do not need a referral. It depends on the kind of services. And again, assess what your own needs are. Do you need a group? Do you need a drop-in service? Do you think that actually, no, I'm ready to tackle some long-term issues? All of those are going to look very different. Bridge the Gap has a great listing of all kinds of range of services. apnl.ca has a list of psychologists if that's the route you think is important to go. And ultimately, we need all of these at different times in our lives and sometimes simultaneously. And just remembering that finding the right fit, both in terms of the service and in terms of the therapist or the counselor, is as important as almost anything else. So if the first time doesn't work and it isn't meeting your needs, be honest and talk to the person, and we'll always help you find what is going to meet your needs.
Dr. Janine Hubbard, thank you so much for doing this tonight.
Thanks, Tony.
Hubbard.